Thank all four of you for your contribution to this hearing. Each of you have initiated plans in your own community to try to fill the gaps on access to care. So one of the questions I will be asking you, if we have time during this first round, is what tools at the federal level have helped you to implement that? And what additional tools would you like to see? Ms. Risch, you talked about and I've been to Chapter many times, the services you're providing are incredible, and you're right, your people are really dedicated to their mission. You talked about mobile facilities or school-based facilities. Senator Stabenow and I worked in regards to the lack of access for oral health care, and we use mobile and school-based as a way to fill that gap, and it worked pretty effectively. So what additional incentives do we need in order to provide that type of services in rural communities? Ms. Ani, you mentioned that some of your community does not have access to internet or even telephone service. How do we expand telehealth to rural America? Perhaps broadband is part of that, but how do we make that more effective, and what tools can we provide to make that work in your community? Dr. Herman, you talked about value-based. In Maryland, we have a total cost of care model, which is, I think, the ultimate in value-based. What other incentives do we need in order to allow you to move forward in those initiatives? So I guess my question to the panel, what would you like to see us do in order to help you fill? We can't fill in the rural community. You don't want us to do that. So the population is going to be sparse. What can we do to help preserve your unique way of life? When you deal with preventive health care and you deal with wellness, it's so difficult if you can't have a more presence in the community, particularly with older population that have challenges, more and more challenges. So we'll go down the line. If you have programs that you think we can help you at the national level to meet your needs locally.
Yeah, so as far as telehealth goes, our community, a lot of them are aging populations, so they don't have the internet, phone, or computer, so that was part of our social determinants of health that one of the markers was high, was connectivity. So a lot of cell phone service we don't even have in the area if they're up north, so our patients are actually traveling down to our hospital to use our computer to access their telehealth in Billings. So maybe getting them computers or something, and then our telehealth in the rural health clinic is capped at a rate of, I believe, $98.24 around there. So those appointments aren't generating as much income either for us, but the connectivity issue would be something I think would be something to address.
And we did some of that in the bipartisan infrastructure bill, but we can look at as to how we could perhaps build that up more. Ms. Risch?
Well, thank you, Senator Cardin. So the school-based health centers are a powerful tool, and when we think about how we can improve health outcomes in rural areas, again, how can we reach people in different ways? And so we have a lot of tools in our toolbox to do that. The school-based health centers are very powerful, and in fact, one of the things that we've recently done was converted 2 of our school-based health centers, I shouldn't say converted, but expanded their reach. So 2 of them are now open to the community residents as a whole, so not just the school community, but the community around, because they are located a far distance from some of the other healthcare access points. So additional support funding for school-based health centers, mobile health units as well. There was a bill that recently passed to include mobile units as part of the new access point funding if there is some available for health centers. So moving that forward is great, but we haven't had new access point funding to bring more of those mobile health units to life. And then the other piece regarding telehealth, it was a lifeline. It still is a lifeline, but preserving the reimbursement for that, not only for the virtual visits, as we like to call them, but also the audio-only visits, because back to my colleague's point, having access to internet, broadband, et cetera, does provide some big obstacles for the communities that we serve. So sometimes that phone call and being able to talk to the patient and connect with the patient that way makes a huge difference.
And we have bipartisan legislation that would do that. Dr. Herman?
Thank you.
We believe that our patients really pay us in three types of currency. They pay us with their trust, they pay us with their time and attention, and they pay us certainly with money. The challenges of the distances across rural America have found, we find it necessary, rather than to have them come to us, we come to them. So we have community paramedic programs that actually help people with chronic management of their chronic diseases, post-acute care, and other things that really make a huge difference. Funding for those types of programs, as well as the training for the workforce that can support those types of programs, allows those patients to stay within their community and get their care. Doesn't need to be always with a doctor or be a nurse. And when you think about the economic cost that some of my colleagues have mentioned about having your son or your daughter take a day off work to drive you from Ely, Minnesota to Duluth, Minnesota for a 20-minute visit and then drive back, that could be better served by a community paramedic, is certainly a challenge for the family and a waste of America's economic vitality. So funding those programs where we can actually go to patients, whether it's through telehealth or the community paramedic program, can make a huge difference.
Dr. Holmes?
I'm going to build on Dr. Herman's comment there, which I think is really astute, and extend to home visits for maternal home visits and child home visits as well. But the appeal of all of these is that you're seeing how the population live in their own home, and understanding, they need a railing here, for example, if community paramedics can go there and avoid a fall. And so really understanding more about the treating health is just beyond healthcare and the whole complete package.
Thank you. Senator Daines.
Chairman, thank you. Mazzani, it's good to have somebody,